Today our lecture about normal labor. Outlines of this lecture: define labor and normal labor, stages of labor, factors affecting labor process or progress, and management of labor stages. What does it mean by labor? Labor is the process by which the product of conception from viable fetus, placenta, and membranes, all of these are expelled through the vagina or birth canal into the external environment. To say it is a normal labor, there is some characteristics that should be considered. Firstly, occurs at term, neither premature or post-mature. Premature means before 37 weeks of gestation, while post-mature means after 42 weeks of gestation. Also has a spontaneous onset, not induced by using medications that improvement or enhancement of uterine contraction. Also, it completed after 4 hours and before 24 hours from the time of its onset. Means neither precipitated labor. Precipitated labor means all process of labor occur within 3 hours or less, nor prolonged labor, not take more than 24 hours. It achieved without artificial aids, means using ventouse or forceps, involves no complication for the mother or fetus, such as excessive hemorrhage, has single fetus presented by vertex. Also, delivery of spontaneous mechanism of placenta. How many stages of labor? All the uterine content or uterine product of conception are expelled in one stage or what? No, it occurs within 4 stages of labor. The first stage means dilatation stage, that starts from the onset of regular uterine contraction until the cervix is fully dilated. When the cervix is dilated, no felt around the head, as we see in this picture. Second stage means expulsion stage, that starts from complete cervical dilatation until expulsion of the fetus. Third stage of labor means separation stage or placental stage, that following the delivery of the fetus until the complete expulsion of the placenta. Fourth stage of labor takes 1 to 2 hours following the completion of labor. All these stages take time for every woman. That may progress with normal or may be stopped or affected or hinder the progress of labor, depending on the factors affecting labor. Factors means 4 P's or sometimes categorized into 5 B's. B for power, passenger, passages, personality, and psychological states. The powers divided into primary power and secondary power. What does it mean by primary power? Primary power is the contraction and retraction of uterine muscle, while secondary power is the voluntary muscular or pushing or bearing down. Uterine contraction, what does it mean by means it? This is the temporary shortening and thickening of the uterine muscle. This is due to hypoxia of contracted myometrium, compression of the nerve ganglia on the cervix and the lower uterus, stretching of the cervix during dilatation, and stretching of the perineum overlying the uterus. Second B is the passages, means bone and soft tissue that affect the progress of labor, like pelvis. If the pelvis is not normal, gynecoid pelvic, and they take android or plataloid or anthropoid, this is not liable for normal labor, but gynecoid is the normal. Diameter is not appropriate with presenting part, also affect progress of labor. Cervix if have trauma or fibroid or edema that hinder or affect cervical dilatation and affect the progress of labor. Also pelvic floor muscle. The passengers mainly what transfer or go out from the uterus to birth canal. Fetus, placenta and membranes. If the fetus is large size and not appropriate with diameter of the pelvic, also affect the progress of labor. Placenta, if the placenta not normal by what means if it is a creta placenta or precreta, also affect the progress of labor, not separated within normal time, so hinder the progress of labor. The personality and psychological states like age and puberty. As we see, the young women and the primipara has no experience related to labor process or labor situation, so maybe affect the progress and the time of labor. Some cases come to the labor unit, but the doctor say you are not in labor after the examination and asking the woman. It depends on presence of true labor pain or false labor pain. If have true labor pain, she is sure in labor and stay in the hospital. While if there is a false labor pain, go the home and return again after changed into true labor pain. Characteristic of true labor pains is painful, regular, increase gradually, present in the back and the abdomen. While false labor pain, painless, irregular, remains is the same, occur in the abdomen only. True labor pain, no effect from sedation, also formation of fore water and combined with dilatation of the cervix. While false labor pain, when take a sedation, relieve the pain, divert attention, the pain is relieved. No formation of fore water because no cervical dilatation. What is the effects of uterine contraction during labor? Uterine contractions that occur in the abdomen affect what in the labor? Affect cervix, affect the fetus, affect the placenta. How it affects the cervix? Affect from cervical dilatation and effacement of the cervix. As we see in the picture, the orange color is the cervical canal before the labor. After dilatation and effacement, shortening and thickening and taking up of the cervix. As we see, cervical dilatation and effacement progress. It is clear in this picture. Uterine contraction affects the fetus by increased general intrauterine pressure, also fetal axis pressure on the placenta according to the stage of the labor. During the first and second stage of labor, there is interference with the placental circulation and do not affect separation of placenta, just interfere the circulation. During the third stage of labor, help in separation of the placenta due to contraction and retraction of the upper uterine segment, followed by descent and expulsion of the placenta. Uterine contraction have phases that begin and reach to the acme or the peak and then take a period of release or relaxation and then become another contraction. As we see in the picture, phases of uterine contraction that at the beginning slow and become reach to the acme or the peak, that called a plateau, and then decrement or a crescendo, and take a period of rest, and then begin of another train contraction. Also from this picture you can know what about duration of train contraction. Duration of train contraction that started from beginning of the train contraction and ending of this uterine contraction, while frequency of uterine contraction means from the beginning of one contraction to the beginning of another contraction. Retraction. Uterine retraction is the shortening that persists after contraction. The muscle fiber doesn't relax completely at the end of the contraction but remains some of shortening and thickening, as we see in the picture. Progress of uterine contraction. This is the primary length of the uterine muscle, and then after contraction is decrease in the length, while take a period of relaxation, increase and not reach to the previous length, and so on until it's become equal. Uterine contraction and uterine muscle equal in the length. Secondary power means auxiliary force, bearing down, pushing down. It is the contraction of the diaphragm and abdominal wall muscle to increase the intra-abdominal pressure. It is at the first become voluntary. You can voluntary and controlling, but later in the progress of labor it becomes involuntary due to reflex stimulation from the pressure of the presenting part on the pelvic floor muscle. Secondary power is important, or bearing down and pushing down is important. Of course it is important when performing at a suitable time and proper time. Like when it occurs in the first stage, it's false to make or use bearing down because it has no effect on cervical dilatation but make a pressure and otimeter cervix that occur from pressure from presenting part on the cervix, and the cervix is not fully dilated during the first stage, while when in the second stage of labor the cervix is fully dilated, and when making a pushing or expulsion it helps in expulsion of the fetus. Third stage, expulsion of the placenta and retained. Importance of bearing down during the third stage. It is important to help in expulsion and separation of placenta. The fetal skull bone. The fetal skull have a bone and have suture and fontanelle. Have 7 bones, 2 frontal, 2 parietal, occipital, and 2 temporal. While the sutures, sagittal sutures between 2 parietal bone, sagittal suture, the connection between 2 parietal bone, and the frontal suture connect between 2 frontal bone, and coronal suture between frontal and temporal bone. Occipital, lambdoidal from occipital and parietal bone. Have anterior fontanelle and posterior fontanelle. Anterior is the diamond shape and triangle shape for posterior fontanelle. Some definitions that related to labor progress normal or hinder the progress of labor. Like attitude. What does it mean by attitude? Attitude is the relationship between the fetal parts each to other. Maybe flexion or extension, and this in the picture. So observe the different degree of flexion and hyperextension. Complete flexion in the picture A, partial flexion in B, partial extension in C, and completely extension at D. Lie. Lie is the relationship between long axis of the fetus to long axis of the mother. Maybe longitudinal, like this, or transverse, and maybe oblique, and the normal is the longitudinal. Position is the relationship between back of the fetus to anterior wall of the mother, maybe anterior or posterior. Also, you can determine the position by three things, like left or right, anterior or posterior, and the presenting part. Presentation. What does it mean by presentation? It refers to which part of the fetus lying in the pelvic plane. Maybe vertex presentation, or breech or sacrum presentation. Station. Station means the relationship between presenting part and the two imaginary line between two ischial spine. So it is refers to the relationship between presenting part to the ischial spine. If the presenting part at ischial spine, means station 0. If the presenting part above, -1 or 2 or 3, and if it is blue or entering, +1 or +2, according you find. Causes of the onset of labor. The exact cause is not known, but there is some theories that support occurrence or initiation of labor. Like hormonal level changes are probably due to placental aging and are as follow. Progesterone level falls and the muscle relaxation diminish. Estrogen and the prostaglandin level is raised, so can initiation of labor. Fetal pressure. When the fetus has grown to its limit in the uterus, it causes increased pressure and tension on the uterine walls. Also stimulation of the distended uterine wall to contract. The capacity or distance of the uterus is limited, not acquired or increased, so initiation of labor is occur. There is some preparatory changes before the labor occurs, like lightening. Lightening means descending of the abdomen, relief of the upper pressure, relief of upper abdominal pressure symptoms, like difficulty in breathing. When the lightening occurs, the pregnant woman can breathe easily, no difficulty in breathing. Pressure pelvic symptoms occur. Why? Because presenting part make a pressure on the lower limb, so there is a pain in walking. Pelvic congestion occurs due to pelvic pressure and feeling of discharge, release of discharge. Pain during walking due to pressure on sciatic nerve. And also frequent urination because the presenting part pressure on the bladder. Ripening of the cervix that occur while making a PV and examine the cervix. Ripening means softening of the cervix. Ripening of the cervix, and the cervix becomes soft and dilated and shorter in the length. What are the sure signs of labor? Sure signs of labor: from train contraction become true, not false. Shoe is present. Shoe means mixture of cervical mucus stained with the blood, coming from the rupture to small blood vessels at the lower uterine segment. When the shoe is present, the labor may be occur within 24 hours. Formation of four waters, as we see in the picture, four waters is formed due to cervical dilatation and the presence of the distance or space that permit formation of these four waters. Cervical dilatation is a sure signs because there is a normal progress. Dilatation in the effacement of the internal os is occur, and this is sure signs of labor. What is the physiology of the first stage of labor? Cervical dilatation is due to uterine contraction, softening and driving of the cervix, effect of for water or bag of water, release of prostaglandin that occur. Also, what is the duration of the first stage of labor? First stage of labor takes different time from primipara to multipara. In multipara, take a short time from 6 to 8 hours. In nullipara, about 12 to 16 hours. Also, cervical effacement is due to effect of four waters, contraction and retraction of the upper uterine segment. It is necessary to know in nullipara effacement occur before dilatation, while in multipara both effacement and dilatation occur at the same times or simultaneously. Labor stages have phases, may be divided into latent phase, active phase, or transitional phase. Latent phase, cervical dilatation less than 3 centimeters, started from 0 to 3 centimeters. Uterine contraction are typically infrequent and comfortable, may be irregular, but generate force to cause slow dilatation and some effacement of the cervix. Active phase started after 3 centimeters, started from 4 centimeters. The active phase is clinically apparent as a follow of the latent phase and characterized by progressive of cervical dilatation, and there is average rate of cervical dilatation in active phase for nullipara 1.2 centimeters per hour, while multipara 1.5 centimeters per hour. Active phase, some box started from 4 to 7 centimeters, and transitional phase from 8 to 10 centimeters. Also, other box divided the labor into latent and active phase. Active phase from 4 to 10 centimeters. At the end of first stage, the cervix is fully dilated, and the uterus, cervix, vagina become a one continuous canal. You can differentiate. Also, the membranes rupture. There are strong uterine contraction, usually occur every 2 to 3 minutes, lasting about 40 to 60 seconds. Physiology of second stage of labor. Changes of uterine contraction as follow. Uterine contraction occur every 2 to 3 minutes interval and lasting from 60 to 90 seconds, and they become strength and more strong. And something occurs or manifestation appears like gapping of the anus and the vulva, bulging of the perineum due to descending of the presenting part, flushing of the face, and sweating. Cervical os is not filled due to full dilatation and complete cervical effacement, appearance of the presenting part from the vulva, Spontaneous rupture of membrane if not occur at the end of first stage. The duration of second stage of labor in multipara from 20 to 30 minutes, while in nullipara take long time, take about 1 to 2 hours. The mechanism of labor. Mechanism of labor is a series of passive adaptive movement of the fetal head in order to accommodate itself to pass through the irregular birth canal. This is steps or mechanisms that take by the presenting part: engagement, descent, increased flexion due to presence of the muscle floor and the capacity is decreased, so the fetus adapted by increased flexion the head on the chest. After that, make internal rotation, extension when the head, the sagittal suture is perpendicular on the same pubis, and the presence of train contraction is expulsion and extension of the presenting part. After that, make a restitution to the pre-uterine position. The head return the pre-position. After that, make external rotation and expulsion of the anterior shoulder and posterior shoulder. As we see in the picture, we see the sagittal suture, engagement, descent. As we see, it rotates to some degree, mild degree, increase flexion, internal rotation. As we see, the sagittal suture become a perpendicular and extension. The head is released, and then restitution. The head is returned to pre-position in the abdomen like this. After that, delivery of anterior shoulder and posterior shoulder. Physiology of the third stage of labor. As we mentioned before, third stage mainly placental stage or separation of the placenta. You can say the placenta is separated when some manifestation it occurs, like the uterus is become smaller and globular due to descending or separation of the placenta. Suprapubic bulging due to the presence of placenta in the lower uterine segment. Sudden gush of blood per vagina due to separation of placenta. Lengthening of the umbilical cord outside the vulva. Also, loss of pulsation in the cord. Duration takes the same times from nullipara to multipara, about 5 to 20 minutes. If it is take more time, maybe indicate there is abnormal inadherence of placenta, like accreta placenta. You can differentiate from this picture from maternal surface and fetal surface. Fetal surface, as we see, smooth, shiny and gray in the color, contain umbilical cord and should be in the center to be normal or eccentric, but when it implanted in the edge is called abnormal and called battledore placenta. While the maternal surface is dark red, rough, and contain different lobules that irregular in the size and may be reach to 15 to 20 lobe. And it is important when you examine the placenta, it is completely no mess of lobe, no missed part of membranes. As this picture appears the separation or mechanism of placental delivery, maybe by Scully's method, that is separation from the central formation of retroplacental hematoma, less bleeding, and occur in the most cases, reach about 80% of the case, while Matthew Duncan method, separation from the age or preferred, increase amount of bleeding, no retroplacental hematoma is occurred, and occur in about 20% of cases. Like this is a comparison between two different mechanisms of placental delivery or separation, Scully's method and Duncan method. Scully's method occur in 80% of cases, less liability for bleeding, start separation from the center, take the shape like an inverted umbrella, presented by the fetal cervix. Duncan method occur in about 20 of cases, more liable for bleeding because separation from the edge starts in the periphery, takes the shape as a button to buttonhole presented by maternal surface. Management of labor. It is important to know no labor is normal until the fourth stage is safely concluded and occurred, and since no danger that can arise at any time to the mother and the fetus. There is some health instructions that given to the parturient woman, like take a rest, for it's important during the first stage. What are the importance of the rest during the first stage? 4. Reserve energy, prevent anxiety, and maintain mental equilibrium of the status of parturient woman. Also, ambulation and walking maybe decrease the need for analgesic and maybe shorten of the labor period or time, decrease the incidence of abnormal fetal heart rate. But you considered something, not all cases ambulated. If there is a contraindication like passage of fluid, premature rupture of membranes, bleeding, the woman take a sedation that may mean not conscious while walking, may be dropped. Not in active phase and cervical dilatation is occurs. Also, there is some health instruction like no bearing down until the full dilatation of the cervix. So it is contraindicated during the first stage, and it is preferable liable to occur in and prefer during the second stage of labor. To take completely and appropriate management depend on complete history taking, examination, and investigation. From history taking, you can detect some abnormalities or some deviation or some consider something is maybe become abnormal, like younger age, have previous history of preterm labor, and so on. Examination. While general examination or local examination, you can detect some abnormalities or deviated from normal. From appearance, she is pale and anemic. When enters the labor, may become in danger like bleeding. So you should make a hemoglobin test to assess her condition. Hypertension. When you assess hypertension or body temperature, if it is abnormal, this is indicator for something is not going well. You consider it and examine for this causes. Abdominal maneuver. From abdominal maneuver, you can detect normal lie, normal presentation, and this case enter to normal labor without complication, while in the transverse lie not permit for the mother to take the process of normal labor because she is transferred into cesarean section. And investigation should be considered while providing the care. Some cases complain from escape of fluid. You think it is a vaginal discharge or amniotic fluid. So, assessing the status of membranes, if that is rupture membranes or intact membranes, from using nitrazine paper test, is placed in a visible pool of fluid around the cervix, and the paper turns blue when is contact with amniotic fluid. So if it is changed into blue color, it is an indicator for this fluid is amniotic fluid. Also another test like Ferning test. Sterile speculum exam may be performed to confirm rupture of membranes. Sample of fluid in the upper vagina area is obtained, and the fluid is placed on the slide and assessed for presence of the Ferning pattern under a microscope. Ferning pattern forms or confirm ROM, rupture of membranes. So it is amniotic fluid, like this picture. As we see, this is formation of Ferning pattern. Also, this is positive Ferning test, and this is negative test because there is no formation of Ferning pattern. Also, this picture for nitrazine test and it changes into blue coloration as an indicator of presence of amniotic fluid. The general principles of management are: you should consider this point while providing the care for parturient women. Observation, intervention if the labor becomes abnormal, pain relief and emotional support for the mother, adequate hydration throughout the labor. It is necessary to evaluate the fetal heart rate. Fetal heart rate in low risk labor women have time for evaluating. As we see, 1 hour every 1 hour during the latent phase of the first stage of labor, and 30 minutes during the active phase of first stage of labor, and 15 minutes during the second stage of labor. While when the case is at risk, there is frequent evaluation of the fetal heart rate for 30 minutes during the latent phase of the first stage, and 15 minutes during the active phase of the first stage, also 5 minutes during the second stage of labor. Also, there is sometimes that need or require monitoring and documenting of the fetal heart rate pattern, like immediately after artificial or spontaneous rupture of the membranes. You should evaluate the fetal heart rate pattern. Before and after medication administration during the labor and the time of the peak of medication action. Also before and after any invasive procedure like vaginal examination, enema, insertion of urinary catheter, before and after ambulation, after any increase in the frequency, duration, intensity of uterine contraction. These are situations that need additional time for measuring and documenting fetal heart rate pattern. This is picture as we see CTG, cardio tachography, have two belts on the abdomen, belt in lower and belt on the up. This is for monitoring uterine contraction, because the top or the body of the fundus is the most dominant part for assessing uterine contraction, and the other to assess the fetal heart rate. There is some signs of an increasingly distressed fetus. As the fetus become hypoxia, certain physiological signs can be noted, like absence of acceleration, gradual increase in the fetal heart rate baseline, loss of baseline variability, late deceleration pattern develops, deceleration gradually increase in the length and take longer to recover to baseline, persistent bradycardia and death.